Okay, I think we are live. And I'll just wait till Instagram kind of notifies the followers. I just put a message to our speaker as well. Looks the connection is strong. Okay. Hi Shweta. So I can see the followers coming up. So I'll wait for a few minutes. Hi Raghuram. Hi Priya. Hi Ruchi. Hello. Bilal Nazia. Hi. So I'm waiting for Shafaq to go live so I can send her the request. Hi Sanya. Hi Priya. How are you all doing? Hope everyone are safe and sound. I'll just send to Shafaq. Here we are. So today's topic is about speech. Meanwhile, Shafaq joins us. Maybe you all can just put down your questions if there were any questions in your mind. Hi Palka, how are you doing? Request. Just accept it.
Hi, namaste from India. How are you doing?
Hello, namaste India. How are you all doing?
I'm good. So I'm just waiting for a few minutes till our viewers are online.
Sure.
So good evening from India. This is Dr. Harish Badiger. And as we all know, we have started this live series of coping up with the lockdown. And today is our 8th live session. And the whole idea was to help out parents, dealing with special needs children and adults, especially during lockdown where one-to-one professional help may not be accessible. So we have been, we chose a lot of topics related to health, fitness, immunity, diet, nutrition. And when it came to speech and language, I couldn't think a better person than Shafaq. I've been following her work since a couple of years, and she's been amazing, very well-known professional. And Shafaq is all the way live here from London. Just to have a quick intro, Shafaq is a London-based speech and language therapist working in a private practice. She is passionate about raising awareness of communication difficulties, especially in ethnic minority communities. Shafaq believes in breaking barriers, networking and sharing information to help and support people with special needs. Life is a learning journey and we are all in this together, is what she says.
Absolutely. Thank you so much, Harish.
And yeah, thank you so much, Shafaq. In fact, I'm so happy and it's a privilege and pleasure to have you live here. So thank you so much for your time.
Not a problem. Thank you so much for inviting me. I'm really excited actually. This is like a first time, being a Pakistani based in London and being able to connect with you in India and to share information. It's a complete honor and a privilege, I feel. Thank you so much.
Thank you so much, Shafaq. So Shafaq, I have made some questions for you in context of speech and language. And we will wait if there are any questions which pop up from parents or therapists online. So, you can address them. So let's go ahead with that. So what are the speech and language disorders commonly present in children?
Harish and viewers, it's an honor to raise awareness of communication difficulties. And in our community, you will find children presenting with, first, everyone's familiar with autism. Then you will have kids who are presenting with hearing difficulties, speech and language delay. What else are we talking about? Swallowing difficulties. So there are an array of conditions that children will present with, including voice difficulties, which need to be brought to the table rather than we not talk about it within the community. So there are quite a few. There are quite a few communication difficulties, and we just need to learn and raise awareness of these, like you're doing, Harish.
Right. Okay. So we move to the next question. It's about the current phase, what we are going through. How is the lockdown affecting most of our children? How can parents deal with children during this time?
I think the first thing to understand is that during the lockdown, everyone's life has changed suddenly. Totally unprecedented. We weren't aware that as a situation, something like this can arise. And because parents are so anxious and stressed, and the uncertainty, it is carrying over onto children, and especially children with special needs in this lockdown. They don't understand how to address the feelings which are coming from the inside, how to process the information from the media. The media is blasting a lot of negative information. There's a lot of negativity coming, and when you're addressing children who are so highly anxious and so stressed, and their school has stopped, they're not able to see their grandparents, they're not able to see family members who don't live in the same household because of the lockdown, it can be quite frustrating, and the frustration can present itself in different manners. It can come out in different manners, which we need to be aware of.
Right, right, right. Okay, so let's move to the next question. What are
Sure.
larynx disorders? How do you think would it be affected by stress? And what is its prevalence in children and adults?
Sure. Basically, I've done a master's in voice pathology. So, voice pathology is addressing disorders of the larynx, which is this portion of your neck where your voice box sits, which is base of the tongue. Your voice box sits there, and a majority of the people will not be aware that their voice is actually affected by the condition of their health, and there can be such issues as, I mean, teachers may be familiar with it, and professional voice users may be familiar with it, that you can have vocal nodules, you can have polyps, you can have all sorts of issues with the vocal folds, which affect the quality of your speech and how you communicate. So the overall quality of your life will be affected if your voice and your communication is, if you have, for example, if you have a polyp or something in your vocal fold, it can give you hoarseness, it can make you have a different pitch of voice, it can affect your self-esteem, it can be painful. So these are things,
Right.
and if it's not talked about, people are not going to be aware that it's actually a clinical condition. And children are also affected by voice difficulties, especially there are loads of factors which affect children, and
True.
which present in voice difficulties. But given the lockdown that we're in, the stress and anxiety often is internalized in a person. So in children, you'll see that children often complain of stomach aches when they're having stress or anxiety issues. And parents are like, why is the child having a stomach ache? But children only internalize it in their stomach. Sometimes adults and children internalize it around the shoulder areas, around the larynx, around the mouth area, so facial muscles. And we call that muscle tension dysphonia. So you're losing your voice not because you have a clinical condition, pathology. You're losing your voice because the stress is making your muscles so tense, so tight, and your vocal folds are becoming so stiff that it's hard to communicate. And if you can imagine a person who's a parent, for example, right? How will they communicate with their family or with their child when they're in so much pain and anguish and stress? So that's
True.
something I feel is important to be aware of. And it can affect children equally. Like in voice clinics in London, according to research, 10 to 40% of patients who present in a voice clinic, they present with muscle tension dysphonia. And you will have the ENT surgeon, you will have the laryngologist, or you will have a voice pathologist who needs to work with people in addressing what the underlying issues are which are presenting in a voice disorder.
Right, right. That is insightful, I think. True. Okay, so the next question, Shafaq, for you is, my child
Mhm.
has extreme craving to crunchy food. And in this lockdown, we are so restricted to limited resources.
Yeah.
He's having a hard time to adjust to food habits. How do we address that?
This is a really interesting question, Harish. I haven't encountered a child as such before, so it's really interesting that you're raising it. And the first thing, there are two ways of addressing this issue. One is the clinical aspect, and one is the social aspect, right? The clinical aspect, if a parent has brought that to the table that the child is having this issue, I'd be interested in finding out if there are any sensory issues. Why is the child more interested in crunchy food as opposed to fruit and vegetables? Right?
Right.
How is their dentition? ठीक है? clinical aspect of since when have they been more interested in crunchy food, I'd be interested in that. And on the social scenario, if the child is more interested in crunchy food and they're getting irritated that they're not getting a food that of their preference, I think parents can take various actions such as getting the child involved in the kitchen. Do a fun and play thing. Children learn but through play. So do story time, use their toys, introduce them to different food items with lots of encouragement, lots of support and encouragement, and not to be critical, because the more, I know it's a difficult situation for all of us, right? But
Right.
in a lockdown, if we're critical or if we're angry at our children at the dinner table that, you have to eat what's on the table, or, you're constantly telling them off or something, they're going to become more agitated and more refrained from trying out new stuff. So there are two ways of looking at the situation, but if they are more interested in crunchy food, not available, have a chat with them. Communication is the best way to go. Have a chat with them, play with them, be friendly with them. Do not be annoyed with them, because they might have an issue why they're not, and they're taking out their anxiety in different ways.
True that. True that. So, Shafaq, I can see a question which has popped up online. I'll read
Uh-huh.
it for you. So, the
Sure.
question is how to deal with hyperfunctional voice disorder in children. I have not assessed instrumentally. Also, wanted to know what tests can I perform.
If hyperfunctional voice disorders, you need to go to the ENT and the voice pathologist at a local hospital, because you need to have instrumental assessments as well. I mean, we have things like the Garba scale, which assesses, auditorily, speech therapists will assess how the voice of the child is sounding. But if they have that problem, then they need to be instrumentally tested as well at the hospital. That's at a voice clinic. Yeah.
Right, right. Okay. So, the next question is how to deal with sensory problems. The question is not complete, actually. That's what I'm trying to assume. Sensory
Okay.
problems related to jaw and tongue. That's all they
Related
have
to.
mentioned.
Oh, okay, fair enough. Sensory. Hang on. Sensory problems related to the jaw and tongue. Basically, I would like to find out what the diagnosis is. Does the child have a diagnosis of any condition? For example, as Harish, we were talking about before, cerebral palsy. The
Yeah.
diagnosis is the diagnosis of cerebral palsy affects the muscle tone of a patient, right? Muscle
Right,
tone, in coordination. So all these factors affect the sensory nerves around the mouth area and the
right,
jaw area. And to address that, you have to find out what the diagnosis is and how we can change it. For example, posture. You can have oral contraptions which help you strengthen the jaw muscles around. So it just depends on the diagnosis, and then we can take it forward from there.
right, right, right. Okay. So the next question for you is what general guidelines you recommend for breathing exercises for children with special needs? I know it's related to OT, but many parents were still interested to,
Sure,
it could be
sure.
done in a very creative way so that children participate in some form of breathing exercises.
Sure, no, it's important if you think about it. I mean, even yoga is really important for kids with their
Right,
breathing with adults. So I think there are two types of breathing, right? One is nasal breathing and one is diaphragmatic breathing, which you're breathing from your stomach. So if, for example, if you have people who stammer, and in one of the management strategies of stammering is you help support the patient develop skills in diaphragmatic breathing, and that avoids all the nasal pathway. So it depends on what helps with the person, but deep breaths, 3 deep breaths before you do anything new or do anything which is stressful will really help.
right, right. So the question next is about the sensory problems related to jaw. So the case is about dystonia.
Okay.
Parent, she happened to comment here. So we
Uh,
were discussing the previous question about the sensory issues related to the jaw and the tongue. So the
yeah.
case is about dystonia. So she is asking if anything can be done related to that.
I think it can be done depending on the severity of the problem. Depending on the severity
Right,
of the problem, and if you present, then like I'm saying, there has to be a clinical assessment, and the strength and the power of the you know of this
The
this
oral
area.
structure to the jaw. Right,
Yeah,
right,
yeah. So
right.
it has to be, and usually these things, Harish, as you will already know, usually these things are dealt with by a multidisciplinary team. So you do need to pull in
Absolutely.
the occupational therapist, you will need the physiotherapist, you will need the speech therapist, and see how best to manage this condition, this
True
situation.
that.
And the severity will it everything will depend on the severity of the patient's condition.
Right, right. Okay. So there are a few more questions which are up here. So
Sure.
how do I help my child with self-talk and singing? The child is interested in singing most of the time.
Okay. So sorry, can you just elaborate what is the concern though?
Okay, so the question, that's all she has mentioned. Okay, so maybe we can move to the next question. We can wait if there is some more information about that. So the next question is, my child is 4 years old. Her
Mm-hmm.
speech is absent. She also has got difficulty in sucking liquid through straw. Her speech therapy is on, but we have had no results. Can you please
Okay.
guide us?
Yeah, sure. 4 years old, no speech, and she is Harish,
Right.
is she drinking with a straw or not?
Uh, she has written she has got difficulty to drink liquid through the straw.
Yeah, so she's basically, I would be keen on finding out. She's basically having a muscle weakness issues, and if she has zero speech at 4 years of age, we need 4 years old of age. We seriously need to get a speech therapy assessment done and look at swallowing issues and swallowing difficulties. And from birth, has she been able to drink milk? Has she been able to latch on to the mother's milk? And has she been bottle fed? And at 4 years of age, a child should have speech, but it's clearly evident here that she needs an assessment by a speech therapist, and preferably by an early development team who are
Right,
specialists in managing children.
right, right. Okay. Thank you, Shafaq, for that. So the next question is, can you suggest activities to develop adequate chewing, as in from molars, in cases where kids just swallow or they don't chew?
Oh, they don't chew, and you want
Yeah.
activities on encouraging them to chew.
Yes.
Okay, it's really interesting. For situations like this, kids learn through seeing their parents model the situations or activities. So if someone doesn't chew and they're swallowing straight away, first thing is get their teeth checked out. Okay. If their dentition is okay, then as a parent, I would encourage them to eat with the child during meal times.
Right.
Eat with the child, encourage the child to chew. Like set an example, do it yourself, and see if they can chew first. And if they don't want to chew, then why? Is there a muscle problem with their tongue that they just propel food right to the back of their mouth? Or is there a problem with their teeth? Or they're just being a bit lazy, which I hope that is not the case. But
Right.
if that's the case, use story time. Read to your kids and read about meal times and how if a kid doesn't want to chew, make it exciting that you're eating food and exaggerate the action of chewing and play a game and give them a reward if they can chew. And different textures of foods are important. So different textures, experiment with them with your child, and make it into a plaything, but make it something that you find out why the child is not willing to chew or being lazy about chewing. I wouldn't say that a child would be lazy, but why are they not willing to chew? As a speech therapist, I'd be concerned about their dentition, about their tongue tone, muscle tone around their mouth, and if they have any swallowing difficulties.
Right. True that. Okay. So the next question is, during this lockdown, most of the time, my child is singing, talking to self, which is really affecting his everyday activities. Any suggestions to reduce the self-talk?
Talking to themselves. That's interesting. It could be that psychologically they're missing their friends or they're missing important people in their life. If you want to reduce that, I think as you go about your daily activities, your daily routine, be talking to the child and get them to respond to you. That come on, let's go to the kitchen, or come on, let's make your bed. Sing a song with them as you're doing activities. Maybe they're missing a communication partner. and they need someone, and that's why they're doing it. And I think as a parent, or as a sibling even, do fun activities together where you're singing together, sing along songs, karaoke, do activities where they know that they can talk to you and you are listening, actively listening to them.
Right, right, right. True that. Okay, Shafaq, we are left with five of our questions till we wait if we have any more questions coming up. So the next question is, how do we work where children have difficulty to build relations with their peer group? Do you think speech therapy would also help him to build his communication skills?
Yes, brilliant question, Harish. And I definitely think speech therapy will help. I'll tell you why. Because when we do speech therapy, a certain model of management is doing group therapy. So social communication group therapy is where you provide a child with a supportive environment where they're encouraged to do eye contact, turn taking. They give each others opportunities to speak. So it's a protective environment where the child is encouraged to make attempts of communication and to develop friendship. Because what are the key things that you need to develop friendship? It's like eye contact, smile at each other.
Right,
These are basic things. And sometimes, depending on the child's personality, they could be an introvert, they could be scared to make eye contact. I mean, for us as Asians, even, it's like in our culture, sometimes kids hear that, oh, don't talk to your elder, or wait your turn. Don't Kids should be seen, not be, should be seen but not be heard. So sometimes,
right,
in some families, it may be that kids don't have the confidence to speak out, to make new friends. So in a social communication group, in speech therapy, you provide an environment where the child can feel relaxed and happy and confident about speaking, and they won't be told off, or or they'll be able to make eye contact, and they're okay to make eye contact. They're okay to smile at a stranger, and they can have their turn in speaking out, and they'll get the airspace.
right, right. Thank you, Shafaq. Okay, so the next question is, now this is a very general question, especially when parents are dealing with children diagnosed with CP, and especially
Mm-hmm.
when we talk about quadriplegic form of CP. So any
Yeah.
advice to work on mouth closure to control drooling?
Yes. If we look back at the diagnosis, why does CP happen? Okay, CP happens because the child incurs a brain damage, okay, possibly at birth, and as a result of that, they have a muscle tone, a weakness in the muscle tone. They have postural difficulties. They will have swallowing difficulties, and as a result of incoordination. So you have to consider all of those. CP it's a complicated situation. You will need multidisciplinary teamwork management, and
Right,
I would also suggest that posture affects a child. The posture affects the child. For mouth closure, you need to ensure there is some form of sensitivity around the mouth area. Usually, treatment to support mouth closure is you can have oral contraptions which help support that. Like
right,
you're saying that if a child drools too much, what do you do, right? You can have medicines. You can encourage swallowing, right? But because you have quadriplegia, it's a complicated situation. It's not straightforward that you tell a child to swallow. But there are
right,
lots of contraptions available. There is an assessment available to see whether it's because of posture, because the drool should not be coming out from the front. You try and move the posture so that the drool is going to the back of the mouth. And you have to be careful about if is it because of swallowing or is it because of an overactive salivary gland. Usually that's not the case, but it might be an overactive salivary gland. But lip closure and mouth closure, if the mouth is not closing, saliva is going to will be drooling out. So for the mouth closure, you need to work on the sensitivity of the area, and you need oral contraptions to help close the mouth, and the posture. I mean, an occupational therapist and physiotherapist like yourself, I mean, you will
yeah, yeah,
know that,
definitely.
working together to
Yes,
establish the
yes.
best posture and management, you can find the answer which best
Right,
supports that person. Yeah.
right, right. So the third last question, what I have in my list. So especially in cases with autism, who
Mm-hmm.
show inconsistent response to names, how do we work on that?
Autism is a social communication disorder. ठीक है? And in autism, it's not a black and white situation. Autism is more of a circle where some kids are good at some things and some kids are not good at some things, right? And they have difficulty and you need input. And how best to support kids, like if they're not responding. One of the systems that we use is PECS, which a lot of parents who have children with autism will be familiar with. It's picture exchange communication system, right? And if children are not responsive, for example, to their name, or I would suggest using visual cues. Like in this lockdown period, if you have a child who's autistic, ensure that they have a visual routine, either taped to the wall, or something, so that the child can see what is expected of them. And
Right.
you can make them a communication passport with their photo on it, with their name on it, and they need to be able to hear it, and the visual cues really help in the management of a child with autism.
Right. Right. Okay, Shafaq. So we move to the next question. So
Yeah.
how do we address aggression or irritability part, especially in children who are non-verbal? What ways can we use to communicate in a right way to understand their needs?
Right. Well, if a child is nonverbal, right, and they're being aggressive, they are trying to communicate something to you. They're trying to communicate a need, they're trying to communicate a desire, they're trying to communicate to you, and because they are nonverbal, it comes out as a behavioral issue, right? And if you have a child like that, so the parent, and usually the parent has a gut feeling that usually the parent knows their child best, and they will know that the child is trying to reach out for something, is hungry, trying to get something. And if the listener, the person on the receiving end, does not understand them, it is going to lead to behavioral issues, to aggression, irritability. I mean, as
Right.
adults, we would be irritable. So communication strategies have to change such that the language used by a parent or the responsible person needs to change, so that you're giving them closed questions as opposed to open questions. So if the child is irritable, angry, if they're hungry, they're looking for something in the kitchen and they can't, and they're throwing things around or something. So give them an option of two things and say, do you want an apple or an orange? Right, so that the child, and try and use visual cues to help the child, and to help you understand your child as well. So augmentative alternative communication, right? Something simple as a whiteboard and a pen, where you just draw something, and if the child is interested in it, or the child can draw something with you. So you have to provide the child with modes of communication which are other than speech, you know, for example, with autistic kids. But if for any reason the child is nonverbal, we need to find out other modes of communication which helps them express themselves and helps them know that the person, the adult, or the listener is actively, they have their attention and they're listening to them and they're trying to help them.
Right. Right. Okay. So there are a few questions. Would you like to read, Shafaq? There are a few more questions.
Sure.
Okay, so I'll read it for you.
Sure.
So my
Yes.
child is 4 years old. He
Uh-huh.
understands all the things and tries to speak with expression, but
Okay.
cannot speak something. I really don't know if it's related to clarity or speech production. So the question is, how can we improve his speech?
So it's about articulation. That he's trying to speak something, but
Yeah,
he's not able to say it clearly,
right,
right?
right,
Yeah, that is most probably an articulation difficulty. The first step in working with children so young is basically we have to make sure their hearing is okay. Right. So normally when I see clients here and they come with articulation difficulties, I ask them when was the last time they had a hearing test, because that usually helps with auditory discrimination. And if a child is hearing properly, and then we assess their articulatory inventory, which basically in simple English, basically to find out what sounds can
right,
they say and what sounds are they having difficulty saying, and whether it's age appropriate. So an assessment by a speech therapist of their voice sample, or taking the child to a speech therapist to be assessed, will determine that why are they having difficulties with articulation, with saying the words that they're interested in saying.
right, right,
Yeah.
right. So the next question is, I have a child for therapy. 8 years old spastic CP. He vocalizes for expression and reception.
Mhm.
I really don't know, it's not framed in a right way, but around 3 to 4 years. Should I go for AAC, AMD and start teletherapy?
I have to be honest, I wouldn't, I would be hesitant in giving advice on this because
No,
you
that's
need
fine.
a person who's a specialist in
Right, right,
CP.
right,
Yeah.
right. So the question is by Dr. Chasnal, are there any applications can you recommend for non-verbal children?
There are loads of applications, there are loads of apps right now for non-verbal children. On Instagram, there are lots of speech therapists who are advertising apps which are relevant, and they'd be happy. You can buy material off their apps, or you can follow their apps. So I think on going on Instagram looking for speech therapists, especially in the USA and the UK, I do know that they have apps which are relevant and more specific to your needs.
Right. Okay, I think we have answered all the questions which I had with me and all the online questions which were present. So again, we
Brilliant.
are on time and to the point. So the last question and last from my side till we have any more questions from the parents. So Shafaq, in general, would you like to, have any general message for the parents to deal with their children during this lockdown phase?
Yes, of course.
And I can request Shafaq, can you try to speak in Hindi for a change?
Can I speak in Hindi? Of course, I'd love to. Do you know, Harish? I used to live in India when I was a kid.
Fantastic.
Yes, I've lived in Mumbai and in New Delhi. So I have very fond memories of India as well. And India हिंदी में बात करने से मुझे कोई परेशानी नहीं है. I hope उर्दू और हिंदी मेरा mixed है, so I hope कि आप
Absolutely.
समझ पाते हैं.
Perfectly okay.
तो आई वुड लाइक टू से पेरेंट्स को कि इस डिफिकल्ट एंड चैलेंजिंग टाइम में कि आप ना अपना अपना ख्याल बहुत रखो. ठीक है. अपना ख्याल रखने में ये होता है कि बच्चा जो है वो समझता है कि माय पेरेंट इज इन चार्ज, कि सब चीज ठीक हो जाएगा. यू हैव टू स्टे पॉजिटिव. ठीक है.
Right.
आपकी जो पॉजिटिविटी है वो आपके बच्चे में रिफ्लेक्ट होगा. द बच्चा विल से कि माय पेरेंट्स आर इन चार्ज, सब ठीक हो जाएगा इंशाल्लाह. तो सब ठीक हो जाएगा. तो बच्चे के बच्चे के पीस ऑफ माइंड के लिए एंड एंजाइटी लेवल जो है वो कम करने के लिए एक पेरेंट का सेल्फ केयर करना बहुत इंपॉर्टेंट है. तो ये जो पेरेंट्स हैं आई नो कि बहुत मेहनत करते हैं अपने बच्चों के साथ, जो बच्चों को स्पेशल नीड्स है, एंड स्पेशल नीड्स नहीं भी अगर हो, every child as they grow up they're going through a difficult time. तो पेरेंट्स अगर अपना ख्याल रखेंगे, अपना ध्यान रखेंगे अच्छे से, तो फिर वो अपने बच्चों को भी संभाल सकते हैं. And in this lockdown I just wish everyone the best of luck. Everyone's going through a difficult time, but बस ये आपको याद रखना है कि everyone's in this together और हम सब एक दूसरे का साथ दे रहे हैं.
Absolutely. We are all together, coping up with this, and hopefully with prayers and healings, we will be out soon and seeing each other. So I
Yes,
hope things just
absolutely.
calm. Yeah, and just we are out of this chaos right now. So I
Absolutely.
don't see questions right now, Shafaq. So I think we will conclude the session. So
Okay.
any parent or any therapist who is keen to get in touch, where we missed out any queries, or if there were any queries which popped up later in your mind, do get in touch with Shafaq. She's very approachable and very professional. I'm sure her guidance will definitely help you to address your queries. So thank you so much, Shafaq.
Thank
Stay safe,
you.
stay good, and thank you so much for making it happen.
Thank you so much for the invite, and thank you to all your followers for all the questions. I really enjoyed the session. Thank you so much, and look after yourself.
Thank you, Shafaq. And here I log off.
Bye.
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 Thank you so much.
Thank you.